Florida is about to lose healthcare at scale. A federal budget bill passed in July 2025 cuts nearly $1 trillion from United States healthcare spending. $800 billion of that comes directly from Medicaid. The consequence is not abstract. Over the next decade, 14.2 million Americans are projected to lose health insurance. In Florida alone, estimates show between 1.4 and 1.9 million people could be pushed out of coverage. Florida already ranks 49th in the nation for avoidable hospital use. That means people arrive at emergency rooms sicker, later, and far more expensive to treat. Now the state is preparing for even more uninsured patients, longer wait times, and higher uncompensated care costs projected to exceed $4 billion over the next 10 years. At the same time, Medicaid enrollment is shrinking while total Medicaid spending is rising. Mental health systems are stretched. Home care waitlists are exploding. Food assistance is being cut alongside healthcare. This is not one crisis. It is multiple systems failing at once. And Florida is at the center of it. Florida's healthcare problem is not coming in the future. It is already locked into the budget. For fiscal year 2025 to 2026, Florida's total health and human services budget stands at $47.5 billion. On paper, that looks like an increase about $1 billion more than the previous year. But dig deeper. Medicaid alone consumes roughly $35.1 billion, accounting for 74% of the entire health budget. More than 4.1 million Floridians rely on it for basic medical care. Here is the contradiction. While Medicaid spending is projected to rise by nearly 8%, the number of people enrolled is expected to fall by about 2%, dropping from roughly 4.3 million to 4.2 million in a single year. More money, fewer people covered. That gap does not disappear. It shows up somewhere else: emergency rooms, unpaid hospital bills, and delayed diagnoses. Florida already ranks 49th nationally in avoidable hospital use and cost. That ranking reflects a system where residents are less likely to receive preventive care and more likely to seek treatment only when conditions become severe and expensive. At the same time, Florida has still not expanded Medicaid. As a result, around 260,000 Floridians remain trapped in what is known as the coverage gap. They earn too much to qualify for Medicaid, but too little to receive Affordable Care Act marketplace subsidies. This gap did not shrink over time. It widened. Federal projections tied to the 2025 reconciliation bill estimate that Medicaid and ACA cuts could push another 1.4 to 1.9 million Floridians out of coverage over the next decade. This is no longer a policy debate unfolding in theory. It is a math problem unfolding in real time. More people need care. Fewer people can afford it. And Florida's health system is absorbing the impact immediately. Florida's healthcare crisis does not stop at insurance coverage. It compounds inside the mental health system quietly, steadily, and dangerously. In early 2023, 33.7% of adults in Florida reported symptoms of anxiety or depression. That is more than 1 in 3 adults, before considering who can actually access treatment. According to national estimates, Florida has more than 516,000 uninsured adults living with mental illness, one of the highest totals in the United States. For many of them, insurance is not a safety net. It does not exist at all. The consequences are measurable. Florida loses 12 people every single day to opioid overdoses. In 2023, 43% of all deaths investigated by state medical examiners involved drug use. The system meant to respond is already strained. Demand for mental health services has increased by roughly 25%. Yet, patients seeking substance use disorder treatment can still wait up to 15 days for care, the maximum delay allowed under current law. 15 days is not a delay. In addiction medicine, it is a risk window. This year's budget allocates approximately $1.4 billion for behavioral health services, an increase of about $72 million from the previous year. But much of that funding relies on non-recurring dollars, including opioid settlement funds that will eventually expire. When temporary money runs out, services disappear even if patients do not. Florida continues to lag behind most states in mental health investment while maintaining one of the highest rates of uninsured residents with serious mental illness. This is how crises stack. Insurance loss pushes people out of primary care. Mental health conditions go untreated. Emergency rooms become the fallback system, and the cost does not vanish, it multiplies. Nowhere is Florida's healthcare strain more visible than in its waiting lists. 1 in 4 adults in Florida lives with a disability. By 2030, 1 in 3 Floridians will be age 60 or older. The demand curve is clear. The system's response is not. Home and community-based services, the programs designed to help seniors and people with disabilities remain in their homes, are overwhelmed. More than 74,000 seniors are waiting for services through the Community Care for the Elderly program. Another 21,700 seniors remain on the Home Care for the Elderly waitlist. The Alzheimer's Disease Initiative has more than 17,000 Floridians waiting for assistance. Funding approved this year will reach only a small fraction of them. For people with developmental disabilities, the picture is even more severe. Florida's I-Budget waiver program currently serves about 35,000 individuals. More than 20,000 additional people remain stuck on the pre-enrollment waitlist. Over the past 5 years, more than $430 million allocated to reduce waitlists was never spent and quietly reverted back to the state. The result is a system where eligibility does not guarantee access. Approval does not guarantee care. Families wait years, sometimes decades, while needs intensify. Waiting is not neutral. As seniors age without support, their health declines faster. As caregivers burn out, institutional care becomes inevitable. And institutional care costs taxpayers far more than early, preventive services ever would. Florida saves money by delaying care, until it suddenly costs much more. For working families, Florida's healthcare crisis does not arrive all at once. It arrives bill by bill. Florida's Kid Care program covers hundreds of thousands of children, but costs are rising faster than funding. The Kid Care budget stands at roughly $923 million. Analysts already project a $47 million shortfall. By 2030, that gap could reach $175 million. That means growing waitlists, reduced services, and families forced to delay care for children who cannot wait. Cash assistance tells a similar story. Florida's Temporary Assistance for Needy Families program pays a maximum of $303 per month for a family of 3. That equals 13.6% of the federal poverty level. Adjusted for inflation, those benefits have lost more than 46% of their value and have not been meaningfully increased in over 30 years. At the same time, nearly 3 million Floridians rely on SNAP to put food on the table. Federal policy changes now threaten to shift billions of dollars in food assistance costs to states. For Florida, that could mean paying $1 billion or more just to maintain current SNAP benefits. Add rising healthcare costs on top of that, and the math collapses. When premiums rise, families do not just cut back on extras, they cut back on food, on housing, on medication. Preventable conditions become emergencies. And when families fall through these cracks, they do not disappear from the system. They reappear in emergency rooms, crisis services, foster care systems, and public hospitals, absorbing billions in uncompensated care. Florida's safety net is not torn. It is thinning thread by thread under pressure it was never designed to handle. Florida's healthcare crisis is not arriving suddenly. It is unfolding in slow motion. Every cut, every delay, and every unspent dollar pushes the burden forward onto families, hospitals, and future budgets that will be far harder to balance. Millions are paying more. Hundreds of thousands are waiting. And the systems meant to protect the most vulnerable are stretched thinner each year. This is not just about insurance premiums or budget line items. It is about a state where people are forced to choose between coverage and rent, between medication and groceries, between waiting for care or never receiving it at all. Florida did not run out of warnings. It ran out of time. And when healthcare breaks, it does not fail quietly. It fails all at once.